I'm working in a cancer hospital, the only cancer hospital that we have in Pakistan. It's Shaukat Khanum Memorial Cancer Hospital and Research Center that was built 20 years back. And over the period of 20 years, we have catered almost 6,300 head and neck cancer patients. The most peculiar thing about our hospital is that we have been given treatment to 70% of our patients free of cost, because it's been on the charity and donations. And from a resource limited country like Pakistan, it's very difficult to run a hospital where you give 70% of your patients treatment free of cost. But again, it's been going, and so far, so good. Yeah, it's been dealing with all type of cancer. But I was just, I'm in head and neck oncology, so I was giving the statistics of head and neck oncology. But otherwise, prostate, breast, we have a lot of, patients for breast cancer. It's in the rising trend for the last 10 years, I think. Yeah, because the use of betel nut, it's very common in Pakistan when we compare it with the Western world. Because in the Western world, you have tobacco and alcohol as the primary risk factors. But for Pakistan, particularly in Karachi, the city of Pakistan, you can see the children using this betel nut. So we have seen patients with children of 10 years of age with oral cancer, oral submucous fibrosis because of the betel nut. So that's a little bit difference in epidemiology. Plus, we don't have oropharyngeal cancers with HPV. We have very rare HPV related oropharyngeal cancer, but it's on the rising trend otherwise in the Western world. There are quite limitations in Pakistan. So far, we've been trying to develop a national database so that at least we should have our right epidemiological figures so that we can further start the programs to train our local doctors and physicians. A lot of quacks are working in the country, plus a lot of people who've been using this betel nut and they don't have the awareness. We have very limited awareness campaigns in Pakistan. But eventually, I'm hoping that with the advent of IFHNOS programs, because last year in Pakistan, Professor J.P. Shah and his team visited. That was not a part of IFHNOS tour, but again, that was quite an awareness campaign for the rest of the country. So I'm hoping that things will improve with the passage of time. We've been working with the current British standards and American standards. The only lacking that we have right now is robotics and navigation assisted surgery. But otherwise, we've been doing local resections, local flaps, free flaps, and regional flaps, and thyroidectomies, paroidectomies, all kind of head and neck surgeries, even laryngectomies. We have a very good team of radiation oncologists, but again, the problem is that very few people are trained. So right now, our hospital has adopted this policy of sending the local fellows to international centers for a period of 1 or 2 year advanced training so that we can have more and more people who are trained in head and neck surgery. Over the period of 20 years, the hospital has developed such a repute that people from all the world, they give funding. And it's difficult to believe that a hospital treating 70% of their patients free of cost. Even J.P. Shah was quite amazed to hear that. But again, things are running. And this is how it is. It's just a matter of repute, which we have actually built over the period of time. Yeah, it's about the surgical outcomes between primary and redo thyroid surgeries, because in Pakistan, as a cancer hospital, as the only cancer hospital, we cannot refuse patients. So we get patients from all over the country with incomplete resections, subtotal thyroidectomies, which again are not the recommended treatment for thyroid surgeries. So we have to take care of these patients as well. And we get very limited amount of patients where we do the primary surgery. Most of them are the patients where we have to do redo surgeries. So it is always difficult to go in the same surgical bed again and again and again. So we have shared our experience of the last 20 years with all these redo surgeries and surgical outcomes of particularly the thyroids, where from the literature from the rest of the world says that the complications are quite high. But our experience is quite different because we have two experienced trained endocrinology surgeons who have been doing these surgeries for the last 10 years. And we do have very similar outcomes between these two categories. In the previous literature, they haven't included those patients where simultaneously neck dissection were performed in thyroid surgeries, contralateral neck dissections, ipsilateral neck dissections, and we have actually, measured the surgical outcomes in terms of different parameters, right? Like the length of the hospital stay, the hypocalcemia, whether it is transient or permanent, and the recurrent laryngeal nerve injury, and the recurrence. So these are the 4 outcomes that we have seen. And in terms of these 4 outcomes, there is statistically no significant difference. But again, it is always difficult to go in the surgical field where someone has done incomplete surgery. So you do face some perioperative difficulties, but not the statistically significant postoperative outcome. We have recently started our second hospital in Peshawar. Again, it's not working to its full capacity. The treatment that we are right now giving in that hospital is only chemotherapy. But again, obviously with the more and more funds that we receive, we'll try to build up radiation setup, and then obviously the surgical team to cater, all these oncology patients. And in future, the hospital has this policy to start a new project in Karachi as well. But again, it all depends on the kind and type of donations that we get.